How much fluid should you be drinking each day while taking Zepbound? Let's talk about what the guidelines say and how to figure out what's right for you. There's no specific FDA requirement for water intake on Zepbound, but general guidelines suggest about 3.7 liters daily for men and 2.7 liters for women. Here's the important part, though. That's total fluid from everything you drink and eat, not just plain water. And these are starting points, not one-size-fits-all rules. Your individual needs depend on your symptoms, activity level, and medical conditions. Always speak with your healthcare professional about what's right for your situation. Before we dive deeper, quick disclaimer, this video is educational only and not a substitute for medical advice. Always consult your healthcare provider for personalized guidance. So why does hydration matter so much when you're on Zepbound? Let's break down what's happening in your body. Zepbound is a dual GIP and GLP-1 receptor agonist. It works by slowing down how quickly your stomach empties, reducing your appetite, and helping with blood sugar control. But these same mechanisms can affect your fluid balance. The medication commonly causes gastrointestinal side effects. Research shows that nausea happens in about 24 to 30% of patients depending on the dose. Vomiting and diarrhea can also occur. When you're dealing with these symptoms, you're losing more fluids than usual. And here's the catch. Because Zepbound reduces your appetite, you might also be drinking less without even realizing it. These effects are usually strongest when you first start the medication or when your dose increases. Proper hydration helps manage those gastrointestinal side effects, supports your kidney function, and helps prevent constipation, which is another common side effect. It also maintains your cardiovascular stability. Dehydration can make you feel more tired and dizzy, which might already be happening as your body adjusts to eating less. Now, about those baseline guidelines of 3.7 liters for men and 2.7 liters for women, remember that includes all the fluids you get from beverages, water, and even moisture in foods like fruits and vegetables. It's not just about chugging plain water all day. Your individual needs depend on several factors. If you're experiencing active gastrointestinal symptoms, you may need more fluids to compensate for those losses. Your activity level matters too. Hot weather, exercise, and your body size all play a role. And here's something really important. If you have conditions like heart failure or advanced kidney disease, or if you're taking diuretics, you may actually need to limit fluids. Always follow your healthcare provider's specific instructions for your situation. Let's talk about practical ways to stay hydrated. Sip fluids throughout the day rather than drinking large amounts at once. This is especially helpful if you're feeling nauseous. Keep a water bottle with you as a visual reminder. If plain water doesn't appeal to you, try adding lemon or cucumber for flavor. Herbal teas, broths, and electrolyte drinks all count toward your fluid intake. Eat water-rich foods like cucumbers, watermelon, and soups. Set reminders on your phone if you tend to forget to drink. And try to drink before you feel thirsty, since thirst is already a sign of mild dehydration. You should know the warning signs of dehydration. These include dark urine, dry mouth and lips, dizziness or lightheadedness, fatigue, headache, and decreased urination. If you're experiencing gastrointestinal symptoms, pay extra attention to these signs. Some situations require immediate medical attention. Contact your doctor right away if you experience confusion, no urine output for 12 hours, inability to keep down fluids, or severe dizziness and fainting. The FDA label for Zepbound specifically warns about the risk of acute kidney injury in patients who experience severe gastrointestinal reactions. This risk is higher if you already have kidney problems or take medications that affect kidney function. Here's what to remember. Use general hydration guidelines as a baseline, understanding that they include all beverages and foods, not just water. Adjust based on your symptoms, activity level, and what your healthcare provider recommends. Pay attention to signs of dehydration, especially during the first weeks of treatment or after dose increases. And contact your healthcare provider if you're struggling to stay hydrated or experiencing severe symptoms. Your healthcare provider can give you personalized advice based on your medical history, any conditions you have, and how you're responding to Zepbound. That individualized guidance is what matters most. Have you found any strategies that help you stay hydrated? Drop a comment below. And if you found this helpful, hit that like button and subscribe for more evidence-based health information.